Hey, welcome to Beyond, everybody. Be sure to hit like and subscribe so the algorithm can find the show. Today we have an amazing guest, Bindi Gudhka, who's the occupational therapist and lead for telehealth for Pediatric Therapy Network. Bindi, welcome.
Thank you, Ben.
Yeah, so glad to have you on. So amid this incredibly crazy adverse health crisis of COVID-19 and all the craziness and disasters associated with it, the crisis has actually had an unintended positive impact on Pediatric Therapy Network, which what you guys are is a specific nonprofit and medical provider forced to look at new ways to treat patients because of shelter-in-place rules. So one such silver lining for you guys, and again, your Torrance-based provider of customized therapeutic care for children and young adults up to 21 years of age with autism, Down syndrome, and other leading disabilities, developmental delays, orthopedic and neurological challenges, including sports-related injuries. So you guys really provide a critical service, and we have this shelter-in-place hit. You have a lot of, I'm not going to call them customers, but patients that really rely upon your services. So with COVID-19, since it forced you to close the person-to-person, speech, occupational, and physical therapies at both your Torrance and Long Beach locations, how has COVID-19 impacted your therapeutic model, and what opportunity have you identified to meet the needs of your patients?
Wow. So before I dive into the positive outcomes that we've had through telehealth and during COVID-19, I'd like to give you some background about PTN and just the magnitude and size of our operation to understand how switching to telehealth was vital for us. So PTN is a 501c3 nonprofit organization, and we've been providing high quality services to low-income families across Southern California, mostly in the Torrance area, since 1996, and we serve close to 5,000 families a year with over 150,000 hours of treatment per year. So having said that, when COVID-19 came around and we had the stay-at-home orders, we actually suspended in-person services before the orders came in place because it was vital to make sure all the staff and the families stayed healthy and felt safe, at the same time taking care of them. So having to take the number of families that we served with the therapists we have 200 people on staff, out of which 150 individuals already work directly in contact. They work directly with the kids. So having to train those 150 to use telehealth to deliver the services was vital. And, the outcome has been so positive. It's been overwhelming because we were, generally the trend for telehealth has been poor adoption, and families and therapists as well, they've been intimidated by technology. But during this time, within a week, we were able to flip all our models, not just for individual therapy, but for group services. We have early intervention group services. We have a social skills and community integration group that goes on. And just for all these models to switch quickly to telehealth was so important. And what we're seeing is that these patient families are feeling so empowered. The parents now know, they understand the therapy process. They're being educated on why this therapy is being done, how it should be done. And what we're seeing is that the therapy goes on long after the session is over, because now the parents are the ones who are doing it. We're seeing that they have to be so much more of an active participant in the therapy. They've gone from being just active observer to being active participant. There are hands, there are voice, there are eyes, and they have now a more vested ownership in the outcomes, since they're the ones who are delivering the therapy.
Well, I want to dive into those questions in a little bit. What I'd like to do is show the audience a video showing the new telemedicine sort of paradigm philosophy and have them take a look firsthand.
Hi, I'm Bindi, and I'm an occupational therapist here at Pediatric Therapy Network. Telehealth is a wonderful way to provide occupational, physical, and speech therapy to our clients by using the webcam and microphone on a computer, tablet, or a smartphone. While the child is at home, the therapist can work with the parent and the child to provide meaningful therapy in the child's own environment. The reason we provide therapy is to help each child reach his or her potential. A common belief is that therapy has to be done in person in the clinic, but there are many cases where therapy at home using our telehealth services can be more beneficial to the family.
My name is Helena. My son Michael received services at PTN. Before telehealth, it was a little frustrating if Michael got sick. I always felt some sort of guilt. Oh, he's going to miss a session. Trying to squeeze in a makeup session wasn't always the easiest thing to find the time for. And I know his therapist mentioned, well, we have this thing called telehealth where you can be in the comfort of your own home and it's just like a video conference. So I thought, well, let's give it a try. And he was really excited about it. He was excited because it's like his therapist got to see where he lived. He was showing her his toys. He was very comfortable. I think the first time we did it, he was even in his pajamas. He thought it was a lot of fun. Our therapist was telling us, hey, why don't you try using this or why don't you try using that? And it was just things I already had on hand at home. I didn't have to go out and get anything or any equipment. So since using telehealth, I find that Michael is very excited for his appointments. He's definitely more willing to try new foods. He wants to share with his therapist, Miss Bindi, look what I can do, I can try this, I'm not scared anymore. I'm so grateful for PTN for everything that they've shown my son, but also shown me. I feel that I'm a better parent because of the things that I have learned through the therapist at PTN.
So that was really interesting video. And what I'm really impressed with is you're saying within a short period of time, when you got the shelter in place orders, you pivoted really quickly to a sort of distance health model. So talk to us about when you realized you had to change your model so quickly. Did you have the curriculum in place already for telehealth or telemedicine? Or what was that transition like? And what did you have to put in place to make it effective?
We were so lucky that we had so many factors working in our favor. And what we had was a lot of, or what was really important was the investment of donor dollars and grants that we had in place before. We had a telehealth program that we've been providing since 2017. So we had the structure for it. We had some training. And before the COVID-19 crisis struck, we had an in-house training program that we developed. So because we already had that program, we were able to go from having 35 staff trained to having all our staff trained in this model. And not just that, you know, we had the infrastructure possible for that. But in addition to that, we have these families that were so committed to having their child progress in their goals and, you know, how helping them reach their potential. So despite their worlds being, you know, going upside down and having to care for their child, they've also gone to being the child's teacher, being the child's therapist while continuing to work. Or many of our families are also out of work. So it's been challenging times, but despite that, they've been showing up to their sessions and they've been working with us. And thinking about that, I'd like to go into how our therapists, they've been so incredible and so flexible to adapt so quickly. They've been creative with their therapies, and so many parents are talking about how they're impressed with how much planning and work goes into these therapy sessions. You know, they're seeing that if one activity or one therapy treatment doesn't work with the child right now, they have 5 or 6 other activities they can pivot to really quickly to hold the child's attention. And that's especially tricky when you're doing it just virtually with your words only. And, you know, we can't bring out a toy or we can't have more of a hands-on approach.
Yeah, you need with kids special effects or something to get their attention. But let me go back. So before COVID, what would you say the percentage split was between person to person at your facilities versus telehealth? Give us some perspective. What that was, it 80-20? Was it 70-30? What did that look like?
I think it was maybe 95 to 5%, the very low percentage that we were using telehealth for. And at that point, what we were using telehealth for was kids that were medically fragile, who couldn't come into the clinic because maybe they were more vulnerable to infections, or, you know, or they were just out of surgery, or families that were living farther and to save them the transportation time. That's when we were using telehealth for them. And now we've gone to serving all our families through telehealth.
So 100% in a few months. And so we all know there's been a lot of discussion around telemedicine, and this may be the wave of the future. I can tell you, in a company I'm involved with medical devices, NIH or National Institute of Health are looking for technologies or for platforms that really push the care out, away from the hospitals, to make sure we identify the most appropriate patients to go to the hospitals in this case. But as you look at, if you look at telemedicine in your business model, do you see this transition to virtual therapy becoming a new normal, replacing the person to person when things get back to normal? Or do you just see it as another tool to help your patients as you move forward?
You know, we've been seeing the success we've had with telehealth during COVID-19 and how successfully we were able to pivot to this new model of therapy. We are going to keep telehealth as a permanent offering, and, you know, hopefully we'll be able to use it to expand our current caseload of more than 5,000 families. So we will be keeping it in our scope of practice. Yeah.
Yeah.
And then we don't want to switch just to telehealth, because we are a specialized sensory integration clinic, and we have special equipment. And having said that, while we want our families to come in because some kids need extra handling, they need more hands-on expertise, they need the specialized equipment, we want to make sure that we're able to continue providing that.
Yeah, I think it's critical. I was listening to a doctor the other day in Texas, and she was talking about telemedicine and trying to deal with their COVID positive patients and the rest of her patients. And she said there is no replacement for in-person, face-to-face meeting with your doctor. I mean, that's what you really need to make the ultimate diagnosis and then treatment of your patients. So clearly, I'm glad to hear that this is going to be a replacement for the high touch, high connectivity that you get in your centers. But how has this telemedicine been accepted by your young pediatric patients? I mean, they're the ones that are being engaged here. And you just mentioned that, it's a little different format because depending on the age, maybe it's hard to get their attention. What's been the experience with the patients, how they've accepted this?
The patients have been amazing. And I was telling this as I was training all our staff that the kids, they love technology, they love screen time. So we just had to dig a little deeper and figure out what it is that's keeping them glued to their screens, right? So when they're doing therapy, for example, maybe if the child likes, say, Elmo, then we're going to make sure we have some Elmo videos lined up, or maybe worksheets that we're going to use are going to be Elmo themed. So we're going to incorporate the child's interests into the therapy. But other than that, also, what we had to make sure was that we're changing our mindset, where we're not the ones that the child has to interact with. And it's okay if the child doesn't even acknowledge me, but if he is responding to his parent or caregiver who's doing the therapy with him, that's okay. So, we've really gone from a hands-on approach to now coaching the parent to getting this child to do activity X or Y.
Yeah, that leads me to the next question I had, because, if they come in person, you guys are driving everything and they're focused on you. Now you're telemedicine, and the parent or the caregiver has to be sort of the band leader, the conductor. So what's that involvement been like for the family members? I mean, what's that? Because if they're not involved, it's not going to happen. So has that been a smooth transition for the family members or caregivers, or help us understand that a little bit more?
I think what I've noticed is, there's been ups and downs. Initially, when we were transitioning, they were really excited because, most of our children, they thrive on routines, and routines is what makes them more cooperative. It helps them navigate the world better. But now that the routines were thrown out of the window, what we were able to provide was a familiar face for them to come back to every week. They know us by face, they know our voices. So we were able to provide some stability there. But, so the parents were like, okay, I see this working. And then as they got used to, you could see that maybe some attention was weaning, and we had to involve the parents more. And, we really had to coach them on how to work with their child, even though it is their child. But there's so much that we've learned through schooling and through our education and experience, like something as simple as, waiting for the child to look at you before you give an instruction, or coming down to the child's level to interact with them. Like if you're standing up here, the child is down here, like they're not going to see what you're doing. Or learning how to join the child's play. So there's so much training that goes in and so much coaching. And I will say there's so much patience that's required from both sides, because, all of a sudden the families might feel like, oh, hey, I have this person who's telling me what to do with my child in my home. And just having that flexibility to accept what someone's saying to you and then trying it that way instead of what you're used to.
What's that experience been like? You mentioned earlier, and I really like this, where, in this COVID era, there's a lot of stresses on parents, and financially they lost their job. They're now at home dwelling with their kids. They got all the dynamics, and now they may have a special needs kid where they have to give more time and attention. What's that transition been like for the parents of your patients?
I can say it's been stressful for them. It's definitely been stressful. And, we can see it. We can see it when they're interacting with us and they share this with us. So what we've been able to do is change the way we do therapy. Because a lot of times when these kids come in for therapy, they have set number of goals that we say that the child has to achieve in 3 months or 6 months. And now, because of COVID-19, there's so much that's different. So what we've been able to do is really take care of the family and say, okay, what is it that we can help you with? You know,
Mm.
is your child running around? You don't know how to get him to pay attention to school. Okay, let's really focus on what you need right now. And then a lot of times these families are not able to do a 1 hour session, for example. They just don't have the time for it. They don't have the resources for it. So we're here to provide whatever they need. You know, if it means providing a home program for them that they can read and refer to, or a phone call to check in. So we're trying to be supportive and provide that support that they need in any way we can.
So help us understand a little bit. Obviously, with autism and Down syndrome is a lifetime experience. Are there any pathologies or issues that you're treating for these kids where in time they'll get better and they're self-sufficient, that you're just taking them through a transition period? Or most of the stuff that you deal with, are these lifelong programs where you're engaging this kid well beyond their adolescence and in technically pediatric phase?
Right. So that's a interesting question, because when these kids come to us initially, you know, we're working on a range of abilities, and that's why they come to us to see a rehabilitation, or actually habilitation team. That's what we call it for peds, for pediatric patients, where they're getting occupational therapy, speech therapy, physical therapy, early intervention. And it's just a whole spectrum of services that they're getting that's working on the child's fine motor skills, for example, how they're going to be able to eat by themselves, or how are they going to be able to navigate the environment safely, you know, going up and down stairs safely, climbing onto a chair and getting off safely. So there's so much that goes into it. You know, them being able to communicate. A lot of times the patients we get are not able to speak, and then they're not able to communicate what they want. So a lot of times they're crying a lot. There's behaviors and families aren't able to navigate. But as we go along, as they progress, the goal is for them to be independent and functional. So at least be able to complete basic activities by themselves, like eating, dressing, bathing, being able to communicate essential needs, and then again, navigating the environment safely. We don't want them to be falling or getting further injuries based off that. But
Right.
it is a lifelong spectrum, and you know, a lot of times it may not be physical, but it could be social, emotional. Sometimes our children have difficulty socializing. You know, they're not able to read cues from people. They don't know what the hidden rules of social interactions are. So there's so much that goes into that.
Now, these kids are also going to school, or are they going to specialized school? So in addition to Pediatric Therapy Network and going through that therapy, I presume they have their educator rooted somewhere. So can you help us understand typically the kind of schools they go to?
Sorry, Ben, I lost you. Can you repeat that question again?
Yeah. So you have special needs kids, and you guys offer therapy to get them over the humps in certain basic skill sets. But I presume these kids also go to specialized schools, because my mind sort of conjures up in this COVID time, lockdown in place, if you will. Not only do the parents have to deal with the therapy part of it, but the education part of it. And so I'm just curious, what kinds of schools do these kids typically go to?
So most kids will go to public schools, and you know, most of these schools are have inclusive settings. So they might have a special needs classroom, or they might be integrated in their classroom, and they're in a regular classroom. So when they're in schools, the school is required to provide them with speech therapy, occupational therapy, physical therapy if it is impacting them academically. So these children get individual services that are based on their medical needs, and then they'll also get services from their schools that are more academic related.
Right. So what's interesting is when I thought about your business model in the Pediatric Therapy Network, and you have 5,000 right now patients, and you could certainly radically expand that with the telemedicine reach. You have therapists that have been trained with the hands-on approach. You're now retraining everybody with sort of the telemedicine or distant approach, if you will. What kind of training programs do you offer therapists? Because if somebody's watching this and they have an interest in doing what you're doing, and now you have this big program for remote or telemedicine, what's involved in becoming a therapist and getting this kind of training?
So currently we have our in-house training that we're offering just to our therapists within the company, but the plan is to provide a formal training for any other therapist that might want to engage in pediatric therapy specifically. And having said that, right now in the current needs, we've had a lot of clinicians reach out to us and say, oh, we need to switch to telehealth. How can we do this? And we've been able to provide them the resources they need to at least get started and have the systems in place that they need, the organization that they need to have successful telehealth sessions.
So as you look across the country, what would you say the demand for virtual therapists are?
Across the country, you said?
Yeah.
I've seen, that's a question that's difficult for me to answer actually, because I'm not sure what the demand for virtual therapy is, but being the lead therapist, I have been getting a lot more inquiries from families saying that, hey, due to COVID-19, I am interested in getting my son or daughter these services, but we don't want in-person services. We do want specifically telehealth services. So I think the demand has increased maybe more than tenfold, but what we're hoping post COVID-19 is to continue to provide telehealth and reach out to the families that are more that are based in rural areas or that don't have access to therapies, or especially highly specialized pediatric therapy that we specialize in.
Right. So does Pediatric Therapy Network just focus on Southern California, or the entire state of California, or could you possibly be the entire United States in terms of your reach?
Yeah, currently we're just in Southern California, but we are hoping that we will be able to reach out to entire state of California and then expand to the rest of the United States.
Fantastic. So the next question that comes up, again, if I'm looking for my next opportunity and I see this podcast, you mentioned that you have right now 5,000 patients and you can visualize that expanding with telemedicine. Can you talk about your expansion plans? And in that regard, you're going to need more therapists. So do you have a certification of completion type coursework that someone could maybe join your network and be certified through you guys, or did they have to go through more formalized training?
Again, so with telehealth, it's just a different mode of delivery. It requires some training in it, and you need to be proficient with computer systems. You need to be able to use, say, for example, Zoom efficiently. You have to be able to screen share and make sure you're having the child be more interactive. So while there is some training that's needed, Pediatric Therapy Network currently doesn't have a formalized certification or training course. However, it is in the pipeline, and we're going to have one in the future. But in the meantime, other than that, we work with licensed professionals, right? Licensed occupational therapists, pediatric physical therapists, and speech therapists, and they go through extensive training before they are able to obtain these licenses. So while they already have the basics, they have, they know their ethics, they're following their guidelines, their professional guidelines, and now we're just taking all of that and putting it through telehealth.
That's fantastic. So again, I'm going to go back to the growth piece. With virtual training in place, how many more pediatric patients would you be able to help? If you went from 5,000, is that 10,000? Is it 15? What does that look like in your planning?
Unfortunately, I don't have the numbers for that yet.
Okay. No worries. So
sorry, at my level, that's the information I have.
Okay, no, that's fair. And where can the audience go to learn more about Pediatric Therapy Network?
So Pediatric Therapy Network, we have our website. You can visit us at pediatrictherapynetwork.org. We are on Facebook and we're on Instagram. And we also have a YouTube page that has a lot of free resources that our therapists and other staff have been able to put together. It's on videos on how to get your child to have better walking or better fine motor skills. Maybe for a lot of the younger kids, it has to do with familiar songs that they can follow along with, because that's how they learn more of their speech. So yeah, please visit us.
And we mentioned you're in Torrance and Long Beach. Are you guys planning to expand down to Orange County, San Diego, other parts of Southern California?
I think the plan would be to expand, but again, I don't have information on that.
Sure. And how are you guys funded? I know you guys are, what do you say, a 501c3? Yes. How are you guys funded? I mean, how can people invest in what you guys are doing?
So we are a 501c3 nonprofit, and we run largely on donations because we are providing these services to families with low income, and it's high quality services. So almost every individual treatment session we have is subsidized, and we need these donor dollars to help us keep up and maintain these costs. So you could again visit pediatrictherapynetwork.org to donate and find out more information. But the other funding sources that we do have is based off our different programs that we have. We have like Early Head Start, which is a federally funded program. Then we do have some early intervention programs that are funded by the state through the regional centers. And then I missed that when we were talking about earlier. Part of our success the success to transitioning to telehealth has been because of the support from our funding sources. You know, all the insurance companies have provided waivers temporarily for us to continue providing services through telehealth. And then again, the regional centers have been so supportive.
Wonderful, wonderful. Well, you guys are on a very critical mission. I'm sure the parents would argue that in spades for sure. And to everybody who's watching, make sure you go to the website for Pediatric Therapy Network. It's a great cause. Bindi, thanks for so much for coming on to Beyond. Really enjoyed the conversation.
Thank you. Thank you for having me.
You're welcome. Yeah. Till next time.